If you're a dog owner or, even just thinking about it, here's something really important to start with. Urinary tract infections. They're incredibly common in dogs.
Oh, absolutely. Way more common than people might think.
Yeah, like more than 1 in 10 dogs will actually get a bladder infection sometime in their life. It's a frequent worry for owners, and even new vet students learn about it pretty much right away.
It really highlights how widespread it is.
So this deep dive is really all about helping you quickly get a handle on what a dog UTI looks like, what's behind them, and most importantly, what you should actually do. We'll try and break down the tricky medical stuff.
Exactly. The goal here is to help you spot the signs early and know, when it's time to take action. Turn that worry into confident care.
Okay, so let's unpack this a bit. For someone new to this, what exactly is a dog UTI, fundamentally?
Fundamentally, a UTI happens when harmful bacteria manage to infect some part of a dog's urinary system. So that's the kidneys, the tubes called ureters, the bladder, and the urethra.
The whole setup.
The whole setup. But usually when vets or owners talk about a UTI, they mean a bacterial infection that's just in the bladder. The technical term is bacterial cystitis.
Right, cystitis. And these bacteria, where do they typically come from? Are they just around?
Good question. So typically they are E. coli, which is, really common bacteria found near the dog's anus.
Okay.
And they basically travel up the urethra, that tube they pee through, and into the bladder.
Oh, okay.
And here's something really important that sometimes causes confusion. UTIs aren't contagious, not between dogs and not to people either.
Oh, that's actually a huge relief to hear. Seriously. Not contagious. Good.
Yeah, one less thing to worry about.
Definitely. So if it's not spreading dog to dog, are some dogs just, I guess, more likely to get them than others? Who tends to be more at risk?
Absolutely, there are risk factors. While yes, any dog can get one, female dogs are definitely more prone.
Why is that?
It's mostly anatomy. Their urethra is shorter, and it's physically closer to the anus, making that bacterial journey a bit easier, unfortunately.
Okay, that makes sense.
We also see them more often in senior dogs and dogs that have other health issues going on. Things like diabetes, Cushing's disease, or kidney problems can increase the risk.
So it's not just about being female or older. Are there, specific physical things, maybe structural issues, that make a dog more susceptible?
Yes, there certainly are. Some dogs, particularly females, might have what's called a recessed or hooded vulva. That kind of traps moisture and bacteria. Or even things like bladder stones inside the bladder can make UTIs more likely, maybe even happen over and over.
Okay, so lots of potential factors there. Given all that, how do we actually spot it? What are the key things we should be looking out for?
Right, the signs, they can vary a bit dog to dog, but classic signs include urinating really frequently, often just little tiny amounts.
Like they keep asking to go out?
Exactly. Or maybe they're straining, like it's hard to go, maybe even whimpering, showing it hurts. You might see blood in the urine, or it might look cloudy. Sometimes they start having accidents inside again, even if they're house-trained.
Okay.
Oh, and excessive licking down there at their genital area. That's another pretty big clue. And sometimes you might notice their pee just smells stronger or different.
So watch out for those changes in habit.
Precisely. It's often those little shifts that tell you something's up.
And what if it gets more serious? Are there signs that it's maybe moved beyond just the bladder?
Yeah, if the infection is really severe, or if it manages to travel up to the kidneys, that's called pyelonephritis,
Yeah.
then you might see more general signs of illness.
Like what?
Like being really tired, lethargic, maybe running a fever, vomiting, having diarrhea, or just not wanting to eat.
Okay, much more systemic signs then.
Right. And it's worth noting, this is different from, say, urinary incontinence. With a UTI, the dog usually knows they're peeing, even if they can't control it well. With incontinence, they often don't realize it's happening.
It's a useful distinction.
And sometimes, believe it or not, a dog can have a UTI with almost no obvious signs. It might only get picked up during a routine vet checkup, like on a wellness screen.
Wow, okay. So we've seen the signs, we know the risks. This leads to the really crucial part. If we suspect a UTI, what's the plan? Why is getting to the vet so important here?
Okay, yeah, this is key. If you suspect a UTI, a vet visit is absolutely essential. Don't wait.
Right.
Your vet will do a physical exam, ask about the signs you've seen, and they'll almost certainly want a urine sample for a urinalysis. That's the basic urine test.
How do they get the sample? Does it have to be special?
For the best, Most accurate results. Vets often prefer to get a sterile sample directly from the bladder. There is a procedure called cystocentesis.
Sounds technical.
It just means using a fine needle to draw urine right from the bladder. It sounds a bit scary, but it's quick, generally very safe, and gives a clean sample, uncontaminated from the lower tract.
Okay, so that avoids contamination.
Exactly. And then, very importantly, they'll likely recommend a urine culture. This test identifies the specific type of bacteria causing the trouble and tells the vet exactly which antibiotics are going to work best against that bacteria.
Ah, so it's targeted treatment.
Precisely, not just guessing.
So once the vet knows what bacteria it is, what's the usual treatment?
For most typical bacterial UTIs, it's antibiotics. And here's the critical part. You must give the entire course of antibiotics prescribed, even if your dog seems totally better after a few days.
Why is finishing the course so important?
Two big reasons. One, stopping early means some bacteria might survive and the infection could just come right back, maybe even worse. Two, it contributes to the really serious problem of antibiotic resistance.
Right, the superbugs.
Exactly. So finish the full course. Your vet might also prescribe some pain relief because these infections can be pretty uncomfortable.
Makes sense. What about, things people try at home, like cranberry supplements? I hear about those a lot.
Yeah, cranberry comes up often. Look, you should be really cautious with home remedies for an active infection. There just isn't strong scientific evidence that cranberry supplements effectively treat a UTI in dogs.
So they might not help.
They probably won't clear an existing infection, and relying on them can mean you delay getting the proper vet care and antibiotics your dog actually needs.
Okay, good to know.
And please, absolutely never give your dog leftover antibiotics from another pet or human antibiotics. That can be completely ineffective or even harmful.
Right. Definitely stick to the vet's prescription. So when does a UTI cross the line from being uncomfortable to being a real, genuine emergency?
Most UTIs, while needing prompt attention, aren't immediate emergencies. However, if your dog absolutely cannot urinate at all or is straining constantly but producing nothing, that is a true medical emergency.
Why is that so critical?
Because a blockage, perhaps from a spout aggravated by the infection, can be life-threatening very quickly. So inability to urinate equals emergency vet immediately.
Got it. Urgent care needed there.
But generally, getting prompt treatment for any UTI helps your dog feel better faster and prevents potential complications, like the infection spreading to the kidneys or bladder stones forming.
Okay, so besides treatment, what can we proactively do? How can we help prevent these infections and just promote good urinary health overall?
Great question.
Yeah.
Prevention is key. First simple thing, make sure your dog always has access to plenty of fresh, clean water. Hydration is huge.
Keep that water bowl full.
Yep. And provide frequent opportunities to urinate. Regular walks, chances to empty their bladder fully. Don't make them hold it for excessively long periods.
Makes sense. What else?
Good grooming is important too. Keeping the genital area clean, especially for female dogs, maybe trimming long hair around the vulva, can help reduce bacteria hanging around.
Okay.
And really importantly, if your dog does have one of those underlying conditions we mentioned like diabetes, Cushing's, even allergies that cause skin issues down there, working closely with your vet to manage that condition well is crucial for preventing recurrent UTIs.
So it's all connected.
It really is. Addressing the root causes.
Well, as you can clearly see, just paying attention to those, subtle shifts in your dog's bathroom habits, it can actually be a bit of a superpower for keeping them healthy.
Oh.
Noticing those little changes really does make a difference.
Absolutely. And just remember, everyone, this deep dive, it's for your information, your education, hopefully sparking some curiosity. But for any real health concerns about your own pet, please always talk to your veterinarian.
All right.
They are absolutely the best resource for getting a proper diagnosis and figuring out the right treatment plan to keep your dog happy and healthy.